by showing everyone. Everyone raise their hand for me, please. Okay. You're good now. Sorry.
Are you ready?
No, I'm trying to get it to balance.
Yeah. Hi. My name is Margaret McLaughlin, and I'm here to talk about urgent cares and extended hours and the benefits that they have for not only the customer, but the emergency rooms and the burden that it would take off overcrowded emergency rooms. Many Americans, both young and old, can get sick in the middle of the night, late at night, when regular doctor's offices are closed, but they're not quite an emergency, what we call like a minor emergency. Our emergency rooms fill up every day with minor emergencies that could be handled in a doctor's office if there was one open. Many bigger cities have urgent cares that stay open extended hours. Some of our smaller towns will close regular doctor's office hours. And the benefit that we could have if they would do it, the cost difference is one of the things we'll look at it versus emergency room and urgent cares, both on the emergency room or the staff side and the patient side. This is just a little example that I found that shows some of the cost difference between ER versus the urgent care. And you can see how significantly lower the urgent care is versus an emergency room. An emergency room department is usually generally part of a hospital or a medical center. They specialize in treating emergency patients. An ER or an urgent care is a freestanding walk-in medical facility that provides care on a no-appointment basis for minor emergencies. According to the Agency for Healthcare Research and Quality, average expenses for all people who had one or more visits to the ER in 2009 were $1,318. According to Kiplinger's Personal Finance magazine in 2011, the average in-network cost of an emergency room visit for someone with private health insurance was about $933. Urgent care costs are significantly less than those of ERs, but are also difficult to quantify. The Annuals of Internal Medicine study found that the average cost of an urgent care visit for the common illness, middle ear infections, urinary tract infections, stuff like that, was $155. Other places, the average urgent care visit at anywhere from $71 to $125. The bottom line is that the urgent care visit is substantially cheaper than the ER visit. According to the, and then we have the benefits also of the ER, the relief that urgent care centers can give to an ER. Many ERs are overwhelmed with non-emergency patients who come there because it's the only place for them to go. If we would have extended hours with urgent care centers, it would help our emergency rooms also. We would take away a lot of the patients that come there. We could come to places like urgent care. With a better understanding of the benefits of extended hours and lower costs, let's look at some of the solutions. Like I mentioned earlier, a lot of the solutions would be to help the ER with the overwhelming of non-emergency patients. Also, we would have lower costs for many of the customers, which I think would help lower the cost of insurance with the lower cost of the doctor visit. Emergency room is ran, like I said, by a hospital and has a bigger staff to support in an urgent care facility at night with minimal staff, which would cost less financially for the facility, which in turn costs less for the patient. Today we looked at benefits of extended hours, relief on ERs, and the cost difference. The emergency rooms are too busy to treat treat all the patients that need help. If urgent care can simply take on some of that responsibility, later in the evening, it could lift heavy burden off the emergency rooms for non-emergency illnesses and save customers a lot of money. The cost for the patient is much less for urgent care facilities than ER, and I think overall we've seen that extending the hours of urgent care facilities is practical and logical. Yes.
I have a question. On the urgent care, do they take the same insurance?
Yes, they do.
The hospitals do?
The urgent care, they have doctors or PAs.
The urgent cares are run by regular doctor, NDs, and DOs, with their licensed staff physicians.
And some PAs. My cousin
Yes, and
is a PA
yes.
and he runs the one in Calhoun.
Are they going to use the same models like any other maybe urgent care types that are already doing later hours?
There are several urgent cares around in some of the bigger cities that do stay open later, and partly due to the relief that it gives the ERs. But our smaller towns, like here in Tahlequah, they close rather early. These are the place that people have to go for a minor emergency after hours is the emergency, which costs the patient more money, insurance companies more money, and it costs time, very valuable needed time to the physicians who are trying to treat the ones who are in need of actual emergency care.
So the urgent care is associated with the hospital.
Not usually. They're usually freestanding individual, privately, not privately, some can be privately owned. They're accredited, but they are not usually associated with the hospital.
I didn't realize there was that much difference in cost. That's a big
Yeah,
difference.
major.
Wow. And it's like